Hello, this is Dr. Do again. This video is continuously with the systemic approach of medicine. Just briefly explain the systemic approach means from the invisible structures, the organic compounds, the cells and the tissues, and currently it's on the tissue level, which is visible. I think I'm talking about the connective tissue associated diseases. Like I finished that, and also on the muscular tissue associated diseases, talk about the injury, the myositis, and also the diseases associated with the smooth muscle, which are majority in the digestive system, from the stomach to duodenum and small intestines, large intestines, and blood vessels, the inflammation of blood vessels or arthritis. So those are all the examples of the tissue, muscular tissue, smooth muscle tissue related diseases. Actually just try to horizontally link everything together, or vertically, either way you think about it, but just connect everything together in a different dimension, I think, compared to the clinical concept. So, and I move on to the cardiac muscle. Actually, today I'm going to talk about the diseases associated with the cardiac muscle. It's so obvious. This muscle is unique to the heart. You cannot find it anywhere. And just in the heart, like the size of our fist. And we already talked about it. The heart has the chambers, have the walls. The walls are the cardiac muscles. And also had the septum is also the cardiac muscles. And also there's some chambers and also the lining epithelial cells, and also some connective tissues, and like the fibers form the valves. So this is basically the heart structure. You probably know it. And also there's some diseases associated with the cardio muscle, which is cardiomyositis. That's one of the directly associated, even though it's not quite common. Cardiomyopathy probably is more common than cardiomyositis. The cardiomyopathy usually referring to those idiopathic, a lot of times idiopathic, without known cause. This hypertrophy or hypoplasia of the cardiac muscle just thicken the walls of the heart. So the consequence of this thicken the wall, particularly if the thicken of the wall occurring beneath of the valve, so it's subvalvular. So that's really, if you can imagine, like something you stack by the door, so that the door cannot fully open. This is the same idea. So the hypertrophy of the cardiac muscle causes this obstruction of the flow. So that's kind of serious. And also sometimes the cardiomyocytes, or the muscle of the heart, stretch too much, lost the elasticity, so cannot complement back, just over dilated. These are all the possible cause the disease eventually leading to the heart failure. So this is and the causes of this, like the hypertrophy, like I mentioned, is majority of case are the idiopathic, some toxic chemicals, medication. There are notorious medication, adriamycin. I think it's the very, very old medication, and for the cancer, chemotherapy drug has a severe toxicity to the heart, cause this cardiomyopathy. And also some alcohol, long-term alcohol, can also cause this cardiomyopathy. And sometimes the genetic diseases, even though it's a valvular disease, but eventually can cause the cardiac muscle loss of strength, leading to the heart failure. So this is these are probably some not common, but could be common, and it's possible. And also it's it could be serious, could be minor, like the cardiomyositis usually can be recovered, unless there's some serious. If the cardiomyositis is caused by the viral infection, then it can recover by itself. But some of the cardiomyopathy is irreversible. So, and there's another very common, very fearful disease, of course, the cardiomyopathy infarction, which means the ischemia caused the damage of the heart. I think I previously mentioned the heart muscle cannot recover by itself. You have to repaired by the fibrosis. The fibrotic tissue move to that area, laid down by the fibroblast and heal that scar. So if you can imagine the fibers, usually they're, unless the elastic fibers, but it's not in that case. The fibers laid out by the fibroblast without the contractibility like the cardiomyocytes. So then the heart will lose the normal function of contraction or dilation. So this is the in terms of the explanation why the ischemia. We have the ischemia, or we cut the muscles, we have cut the skins, can recover, but this cardiac muscle cannot fully recover. So that's why it's so serious and impose the future risk. So in terms of this cardiomyopathy or the myocardial infarction, I think you know it. You probably see people around you, or you heard it so often, and also the risk factors, the notorious risk factors, hyperlipidemia, or hypertension, obesity, and overweight, and sedative lifestyle. So these are all the risk factors I have repeated so many times. The purpose for this video, of course, is to, in addition to explain at the tissue level what happened to this myocardial infarction, and also MI, actually short form. Probably a lot of people heard MI. They know what is MI. They do not know what is myocardial infarction, probably. But it's so this is in terms of the treatment. It's emergency and symptoms. I think it's you probably know it. The chest pain associated with activities, particularly the upper extremities activity, and cause this, and also sometimes running also can cause this. So this is about the, in terms of the treatment, there are different options. So the exertional chest pain, that is probably sometimes it's you do not know you have it or do not have it. So sometimes you probably heard about the stress test. That's just the test to challenge the heart, to increase the heart rate and contract faster, and also so then to test whether there's some ischemic, a subtle blockage of the blood vessels. So if you have the risk factors and a long-term hypertension, and also either obesity or overweight or hyperlipidemia, and you have this discomfort on the chest with the exertion, or for example, you're walking up hills or climbing stairs, and you have it, and then when you rest, it gets better. I think that's probably a good idea to talk to your physician to do this treadmill test to see whether it is a real blockage of blood vessel half open to cause this ischemia, or it's probably just a spasm. So that's probably the other purpose for this video. So I'm going to stop here. I think it's kind of here or there. I hope just you can pick up the important information and remind you or help you. And thank you for watching. I will see you next time.